It's a conversation crossing state lines.
Telehealth is certainly a huge part of what we do now and what we're going to do moving forward.
A pandemic solution that's sticking around.
It's an enormous benefit. People can fit it into their day more readily.
We saw how much easier it was during COVID and that there's really no reason to go back.
But can it go too far?
We don't want to relax the standards to the point where we're compromising care.
This morning, get the answers you need as KNWA and KXAN Investigates present Telehealth, a live Q&A.
Hi there, everybody, and thanks for joining us. I'm Will Dupree, coming to you from KXAN in Austin, but we want to welcome all of those who are joining from all over our state and even some in Arkansas. So please, thanks again for being here. This morning, we are going to talk about a healthcare solution that emerged much more prominently during the pandemic and is now here to stay. We're talking, of course, about telemedicine. Right now, there are 37 states, the Territory of Guam, and the District of Columbia that joined what is known as the Interstate Medical Licensure Compact. Those are all the places you see here shaded in green. That compact is an agreement that states enter to speed up medical licenses, and it makes it easier for doctors licensed in other states to treat patients. We partner with our sister station in Northwest Arkansas, KNWA, to take a closer look at this nationwide solution. And it's helping to fill the gaps with doctor shortages that states may be facing, but it does have some limitations. We're taking a solutions approach and digging deeper into what this all means for you with a panel of 3 guests this morning. So let's welcome them now into our conversation. Here talking to us this morning is KXAN investigative reporter Arzo Dost. Hey there, Arzo. Thank you for being here.
Hi, Will.
KNWA's Perry El-Yadrani from our Northwest Arkansas station. Perry, thank you for being here.
It's my pleasure. Good morning.
And finally, we have Kyle Zebley there with the American Telemedicine Association. Kyle, welcome to you too.
Great to be here. Thanks so much.
Yeah, it's very nice to kind of lead this conversation and answer some of the questions that we have out there. So I just want to start with Kyle first. Kyle, of course, you work for the American Telemedicine Association. A lot of people are familiar with telehealth, especially after the pandemic. Many may have had a doctor's appointment through this particular option. The compact we were talking about a minute ago, being a part of it means more appointments can happen virtually, but how does that affect in-person treatment options?
It doesn't affect in-person treatment options. Really, it augments it, and oftentimes it's in lieu of what would have been an in-person visit to begin with. At the end of the day, all telehealth visits is another way to access clinically appropriate health care. And it's really important for your viewers to understand that the same standard of care that a provider must adhere to when delivering care in person also, of course, applies virtually. And so it's another way to use technology to deliver more clinically appropriate options to more Americans and to more patients. That, at the end of the day, is what telehealth is.
And I'll just add to that, in addition to what Kyle was saying, for instance, in our piece, we talked to Dr. Nikki Davis, who's based in Utah, but is now treating patients virtually here in Texas. And she made a really clear point about there are things that I'm going to be able to treat, but there may be some things where you should still have an in-person doctor to go to. For instance, if she needs any lab work to be done, there's a lab that they work with through plant-based telehealth where you go and get your lab work done. But if you need to see that person for that doctor for a much bigger issue, then that they have the option to do that as well. So there may be some circumstances where you still need to have an in-person doctor, but for the most part, what she's able to do, she can do through the telehealth virtual appointment and then the lab that she works with.
Perry, I want to ask you, you are in Arkansas, as I mentioned a little bit earlier, which is weighing some of the options for telehealth and possibly joining this compact. Where does that work stand at this point?
Well, currently there is no bill currently in our legislature, and they are in session to bring that compact to our state. much like Texas did a couple of years ago and started actuating that in the past year. But we did talk to representatives for this story because we wanted to bring it up again. I was talking to our current House Chair, Representative Lee Johnson, and he was describing that the last time our state had considered it was actually back in 2017. And this compact is still relatively new. It came out in 2014 is when it all started. So I think at that time, what he was expressing to me at least was that and he wasn't a legislator. He wanted to make that very clear to me at the time, but he was reading from reports that what folks were saying were that they were worried about the maturity of the compact. They were worried about just how much time it had been out. At that time, there weren't 37 other states that were part of the compact. Now there are. And so when I raised the issue with him, he said, well, maybe this is something we take a look at again. So no bill currently in the legislature, though. Now that more states are reporting these results, certainly as a consequence of some of the reporting that we've been doing and the conversations we've been having, I would be surprised if it didn't come up in the near future.
We'll definitely have to keep tracking that. Kyle, I wanted to turn to you again. What are some of the limitations about being a part of this interstate telehealth compact?
Well, you still have to go through the process of getting approved by the state regulatory agencies in question, even if you're out of state. So just by virtue of your state having joined the compact doesn't mean that you're automatically a physician or that it's good to go in the state in question. You still have to go through the work of getting cleared and approved. It streamlines the process. It really kind of holds your hand a little bit, the compact itself, to get you good to go and licensed and ready to practice virtually in a state in question. But there are still hurdles that you have to go through. It's not a reciprocal compact, for instance, the way that the nurses compact is. So you do have to go through additional steps in order to adhere to the standards as outlined by the compact.
And Perry, during your coverage, you talked about some of the barriers to accessing telehealth options. What did your reporting uncover about that?
So in terms of the compact, some of the barriers actually were similarly reflected in telehealth itself. So there was that fear of lack of regulatory control, I think was kind of something that we discussed in our piece with a lawmaker about why they're afraid to bring that compact to our state, but then to address the barriers to telehealth directly. I mean, and I'm sure Kyle can second a lot of this, is there are still a lot of things we can't do. And we discussed that a little bit earlier, but to go further in depth, for example, some prescriptions, controlled substances, can't be prescribed without an in-person visit, at least occasionally. And there are still several laws that surround the area. In fact, it was even more regulated before the COVID emergency that was declared by the federal government. So when we're seeing a lot of those protections, I believe they're planned to be rolled back in May by the Biden administration. They announced that. I think a barrier that we're going to be running into in the next few months is, what does it look like in this post-pandemic era of laws in this landscape? How much is our state, in the gap of that time where we've had the pandemic to allow telehealth to grow, legislated so that some of the things that we enjoy now can continue to be enjoyed? Because I think that, in my reporting and the discussions I've had with some business owners who operate in terms of the compact and operate with telehealth frequently, that's their main concern is, what is my business going to look like in 3 to 4 months? Is this something that I should keep expanding into? Or is this something where I have to wait and see for the laws to kind of catch back up to where we already are?
And Will, I'll just add to that,
Sure.
when we're thinking about barriers, those are certainly limitations, barriers with the compact. But when you're thinking about barriers impacting families, it's being able to access telemedicine. In some of our rural counties, we're still, hearing from families that just don't have the ability to be able to access it, though there is work being done to, combat that. So that would be one barrier that families, in our outer areas face.
And Arzo, you spoke about children there. I think a lot of parents may be joining our live stream and wondering, how does telehealth work for kids particularly? So maybe Kyle and Arzo address that. What does that look like with families who have children?
Well, it's as if you would be taking your child to the doctor's office or the pediatrician's office as it already stands, but you just have to be there accompanying the child or make sure that you're approving as the legal guardian of the child the interaction that would be happening via telehealth. And obviously, when we think about primary care, preventative care, mental health care, other forms of therapy, those are things that telehealth does extremely well. To an earlier point, obviously, we're talking about licensed medical professionals making a determination whether or not the standard of care can be met in a virtual circumstance. And to everyone's point, that not every circumstance is appropriate for a patient. You have to make sure, as a licensed medical professional with that medical training, with the oversight of boards and other regulatory agencies, you can attest to having met that standard. And in so many circumstances you can, but obviously for now and for many years and decades to come, there's always going to be a circumstance where you need to lay hands on a patient for particular conditions. But for children, which telehealth works at very well, you have the same rights and responsibilities as a legal guardian as you would if you were taking that child into the hospital, into an emergency room, an emergency clinic, or a pediatrician.
And if I may jump in here
go
real
ahead,
quick.
Perry. Sorry.
I wanted to add into this kind of combination of care, because we're seeing this hybrid model being discussed a lot too. And I think that's something that we kind of often overlook, because I think when we easily look at it, we're saying, okay, when can I do the entirety of my care? Think therapy or something like that, where it can be done entirely remotely. But when I was visiting Texas for this story, and even when I was talking to some of our own healthcare leaders, they were saying, just even the ability to do hybrid care was immensely helpful. So say you have to travel a really long distance to go seek the kind of specialty care you need. I know cancer care especially, folks travel quite some distance to go to the right place that's right for their family. So a lot of cancer care hospitals are saying, well, this helps us because we can facilitate some pre and post-op care appointments that we would normally ask you guys to travel multiple times. Now you can travel a lot less and get that care a lot more affordably.
Going back to also the children aspect of it, as the doctors that we've talked to had mentioned, you would go somewhere else for your lab work. Kind of works the same way with your children. Instead of getting that flu test, strep test, or COVID test in their office, after your telemedicine appointment, you go through a drive-through system in many of the family practice clinics that they've now set up, where someone comes outside, you're in your car, they test your kiddo for whatever the testing needs to be done, and then by the time you get home, you have those test results. So they have measures in place that can help with all of this. And also, before your appointment even begins, doctors tell us there is a pre-screening that's done by one of their nurses that, checks in as far as what is the temperature that your kiddo has this morning, how much do they weigh, has anything changed in the household circumstances. So you get the pre-screening, and then you get your telehealth appointment, and then if you need to get the testing, you go through the drive-through or outside clinic that's set up.
And Kyle, you touched on something that I wanted to ask you about slightly in your previous answer. How do you maintain privacy with telehealth options?
Well, you adhere to it by making sure you're complying with the law. And obviously, in terms of when you look at the HIPAA law nationally that governs how a provider must protect a patient's healthcare information, those standards, of course, still continue to apply to HIPAA-covered entities. And so it's a huge issue of importance to the telehealth community that want to do all they can to protect the patient data, make sure that the patient knows they own that data, and make sure that they understand what you're going to be doing with it in order to offer the best and highest standard of possible of treatment to the patient. Obviously, if a patient consents, which is still very much required, then you can share that information with other medical professionals in order to make the best determinations in the best interest of the patient, as we would want the healthcare system to do. But many of the same standards that apply, of course, in person in terms of HIPAA apply to the telehealth organizations as well. During the pandemic and the corresponding public health emergency that Perry was talking about earlier, which will be set to expire on May 11th, HIPAA, in terms of video platforms and other audiovisual telehealth platforms, has been temporarily waived But already we're hearing from our members that they're well in compliance and nobody's expecting that waiver to continue post the end of the pandemic. So there should be a real degree of trust and understanding that the patient has that there are many rules and regulations in place to protect their data when interacting virtually with healthcare providers.
And I just want to thank all four of you, or all three of you, for joining us here for this live stream to answer quite a few questions. We've touched a number of bases, but before we wrap up our live stream, and we'll continue our conversation offline for many of you at home, but are there any other points that the three of you would like to make before we wrap up our live stream this morning?
Well, Will, if I could,
Sure.
I think that was a really fantastic point that was made earlier about hybrid care, also known as multimodal or omni-channel care. What we want to do and what we're developing now and what's really been sped up during the pandemic is embedding appropriate technologies at every step of a patient's journey through our healthcare system, and to maximize efficiencies and ease of use and access for patients. At the end of the day, that's what the telehealth community is seeking to achieve, and partnering with our medical professionals to make sure that we're making the most out of our technological advancements to really put the patient front and center for the best possible experience with the best possible healthcare outcomes. We've made tremendous strides over the last several years. Indeed, ATA celebrating our 30th anniversary, so this kind of work has been a long time coming, and it's really coming to fruition. But what we're seeking to do is do as much as possible virtually for ease of use for patients across the country. And we want to make sure that our laws, both at the federal level and at the state level, are streamlined as such to facilitate that technological forward advancement in how we're delivering healthcare.
And Kyle, really quickly, we've been asking viewers to send in questions, and I did get one question that I think you could answer. What if telehealth is the only appointment you can get, and you can no longer get an in-person appointment as easily as you could before?
We don't, no one in the telehealth community wants to limit options, and I don't think that's the case now. Now, oftentimes, if you have to go through, for instance, some healthcare systems make you go to a primary care physician before getting referred to a specialist. If some of that's done virtually in order to get you the care that you need, I think that's appropriate and standard practice. But if it's the only option and a patient needs to see somebody in person, no one wants that. That shouldn't be allowed. That's not the future that we're seeking to build. We're augmenting and streamlining our healthcare system to make it easier for the patient to use and to make sure that they have increased numbers of options and availability. What we're not seeking to do is replace in-person care. That wouldn't be adhering to the standard of care. That wouldn't be in the patient's interest. And nobody that I know of is supporting policies that would facilitate something like that.
And if I may jump in, just
Sure.
kind of as I'd like to close here for my end, is I would just encourage anyone watching this live stream to think about what do they want their telehealth future to look like? Because I think traditionally healthcare, we see it as kind of an entrenched practice, right? A lot of things are foundationally set so that they're not so flexible. But right now we're at this opportunity where now states and the federal lawmakers are looking at telehealth and trying to decide where they want lines to be drawn. And so if something about telehealth unnerves you or something about it gets you really excited, I would encourage you to reach out to your local lawmakers, your national lawmakers right now, and let them know, because I think this is a really unique point in time where your voice could really be heard and really could impact the future of this field that will frankly probably heavily affect us for the rest of our lives. And it may not be so flexible years down the line as it is now.
And we're going to throw in one more question, Kyle, before you go, that we've been getting. How can you know if your doctor has been licensed to be able to provide this kind of care?
Well, that is the law of the land. They are violating the law. Of course, many organizations disclose at the beginning where the physician is located. That's many states, that's not mandatory. But if you are not doing so, if that provider is not doing so, there are many layers of accountability to bring that person to the requisite regulatory agencies, because they have violated the law if they are not licensed in the state in which the patient is located. And we have lots of laws on the books and regulations in place to protect that from happening.
All right, everybody. That is Arzo Dost, Perry Eliadarani, and Kyle Zebley all joining us this morning to talk about telehealth. There are so many more questions to be answered, but I just want to thank you all for your reporting and your time this morning answering some of our questions. We really appreciate it. Thank you all again.
Thank you.
All right, everybody. If you would like to continue asking questions, you can send us this hashtag right here. Arzo and Perry are going to keep the conversation going online, and the hashtag there is telehealth questions. So send us those as soon as you can. Thanks again for joining us here this morning. I'm Will Dupree in the KXAN live studio in Austin, Texas. We appreciate you being here. Hope you all enjoy the rest of your day. Take care.